Good morning, dear students. I hope you all are well and fine. My name is Mrs. U. Palaniyammal, Assistant Professor, Vinayaka Missions, Annapurna College of Nursing. Today I am going to take the topic which is need for the medical profession as well as the technologies. Because we are going to handle the human being, we need to give some new innovative ideas and new technologies. So if we want to give new ideas or innovations, we should go for the research. Yes, I am going to take research. Introduction. Always research will start with the problem and end with the solution. Because we are going to take the problem and we are going to find out the solution for the problem. Again we are going to start the problem with the solution and we are going to give the solution for that problem. Nursing research, we are going to handle the human being having so many problems. For giving quality of nursing care, we should conduct the nursing research. Meaning of nursing research. The word research is given by the Latin word. Okay, re means once more or go back or doing again the study. Search means we are going to find out the solution for our research problem or health problems. This is research. Re means once more or once again or go back. Search means we are going to identify the solution or find out the solution for the problem. Next definition, it is having two definitions. One is for common research definition, another one is for nursing research. Research, it is a systematic and scientific procedure to find out the solution or truth for the problems. Research means we are going to find out the solution or truthful ideas for the problems. Nursing research, it is also scientific and systematic procedure to find out the solution and truthful idea for the nursing practice. Characteristics of nursing research or criteria for nursing research. When we are going to conduct research, we have to follow these characteristics. There are 7 characteristics is that. First one is empirical. When you are going to conduct the research study or when you are going to select the research problem, you should see whether the research problem or your research study will give direction for the future researcher. Next one is logical. You have to give the solution for the problem. It should be logic. It should be give the correct solution. Then next one is cyclical. Research always having the cyclical process. It is having so many process. Already I told research will start with the problem and end with the solution. Again it will start with the problem and end with the solution. So it is called cyclical process. Analytical. You should see whether you can get better result for your solution, for your problem. You have to analyze whether you can analyze for the problem, like that you have to see. Next one is critical. You have to conduct the study in deeply. You should not give the basic idea or basic information for your research. You have to give the correct ideas or correct result. Next one is methodological. Always in nursing, we are having so many steps of procedure. We are following the procedure step by step. Like that only in nursing research also, if you are going to conduct research, you should follow the steps of nursing research. You have to go with first step, second step, third step, like that you have to go by the step by step. Next one is replicability. You have to give the space for replication of your study by conducting by others. Okay, you should give the ideas for the future researcher. Your research result should give the ideas for the future researcher. This is the 7 characteristics or criteria for nursing research. First one is empirical, logical, cyclical, analytical, critical, methodological and replicability. Next we will see why the research is need for nursing. Why as a nurse we have to conduct the research. What is the need of research in nursing practice or nursing education or nursing administration? We will see 5 needs is there. We will see step by step. Okay, first one is development and generation of knowledge. Okay, first step, development and generation of new knowledge. If you are conducting the research or if you are doing the review of your practical knowledge, you can get the new ideas. For example, I have completed my BSc nursing in 2004. That time they have given some steps of nursing procedure. Now they have given new ideas in the nursing procedure. So I should review or I should go for the research to get new ideas from the new persons. Next one is improvement in education and nursing management. Okay, if we are conducting the nursing research only, we can give the innovative technology for teaching the nursing students. And nursing management, if you want to keep the patient records, if you are writing in the paper, it will spoil. So we have to keep the health information system. Through the research, we have to identify the health information system to keep the patient profile. Next one is evidence-based practice. If we are doing any procedure in the hospital settings, you should have the evidence for your practice. That will prevent legal problems for you. If you are giving any dressing or if you are giving any medication, you should have the evidence. Why we are giving this medication for the patient? Why we are giving this care for the patient? You should review and give the evidence based. Next one is standardize and refining nursing practice. You can standardize the nursing practice if you are conducting research. If you want to modify your nursing procedure, you should conduct the research and get approval from the research committee. You can formulate the steps of nursing procedure. Okay, next one is finding you first-hand experience. Once if you are conducting the research only, you can get the experience to conduct further study. For this purpose, for these needs only, we are as a nurse, we are conducting the research. There are 5 needs is there to conduct the nursing research. First one is development and generation of knowledge, improvement in nursing education and nursing management, evidence-based practice, standardization and refining nursing practice, findings give first-hand experience. Next one is purposes of nursing research. First one is generate new knowledge. You can gain new ideas and new information through your research. Next one is review and produce existing knowledge. If you are conducting research, you can improve your existing knowledge. You can reproduce your knowledge. Next one is construct and create new procedure. If you are conducting research, if you are doing the review, you can start to write the new steps of nursing procedure. Next one is explain new phenomena. The same like the third point. If you are conducting the research, you can give the new ideas for the nursing procedure, nursing education or nursing management. Next one is investigate existing situation and problems. If you are conducting the research, you can investigate the current situation. For example, in the pandemic situation, our medical professionals, we need more vaccines to safeguard the peoples. That time the doctors and researchers, they are conducted research to find out the medicines and vaccines. For the current situation, if we want to handle the current situation, we should go for the research. Next one is provide solution and suggestion and recommendation to problems. If you have knowledge regarding research or if you have conducted research regarding particular problem, you can give the suggestion and ideas for the future researcher. This is the purposes to conduct the nursing research. Next one is scientific method. If you are going to conduct the experimental study, you have to follow the some steps of research steps. Okay, first one is ask question. Okay, if you are going to conduct research, you have to ask question yourself. How I am going to conduct the research? Regarding what problem I am going to conduct the research? Whether I can conduct the research? Whether I can get the solution for the problem? Like that, ask questions yourself as a researcher. Next one is do floor studies. You have to do the background study, that is called pilot study or miniature of your main study. You have to conduct small studies regarding the main study for getting the feasibility of your study. Next one is formulate the hypothesis or objectives. Before going to conduct the research, you have to formulate the hypothesis. Hypothesis means prediction of your research result. What result you are going to get after your study, that you have to formulate before conducting the study. Next one is test with experimentation. You have to conduct the study. Okay, what problem you have taken, for that problem what solution you are going to give, what intervention you are going to give, that you have to start by collecting the data for giving the intervention, and post test also you have to collect. This is the test with hypothesis. Next one is record, analysis, observations or result, draw the conclusion. After your research study, after collecting the data, after giving the intervention or after giving the treatment, you have to go for the analysis. You have to test your research result report, whether you have achieved your hypothesis, whether you got the result or whether you got your prediction. You have to do that analysis. Then you have to record your result. You have to record your result in the written form, and you have to write the conclusion. At the end of the research, what result you have got, you have to write the conclusion. After writing the research report, you have to publish your paper. After writing your research report, you have to publish your report. Okay, then you have to see whether you got the research result correctly or you got the research result wrongly or your research result is flopped. You have to repeat once again. You have to find out why I didn't got the good result for my research study. What is the problem behind that one? You have to identify that one and you have to rectify that one. You have to go for repeat the research once again. This is the scientific method of research. Okay, first one is ask a question. Second one is you have to do the flow study. Third, you have to write the objectives or hypothesis. Next, you have to go for the test the experimentation or test the hypothesis. Then you have to do that analysis and interpretation. Next, you have to write the records and reports, and you have to write the conclusion. After your conclusion, you have to go for the publication. If you got good result, you can go for the publication. If you are not getting good result, once again you have to repeat the research. This is the scientific method of research. Next, we will move on to types of research. Types of research, it is having three classification according to the purpose, according to the process, according to the outcome. According to the purpose, it is having three types. According to the process, it is having two types. According to the outcome, it is having three types. According to the purpose, we will see first one is exploratory study, second one is descriptive study, third one is analytical study. Okay, according to the purpose, there are three types. According to the process, quality study, quantitative study. According to the outcome, applied, basic and action study. Okay, first we will see purposes of research studies. First one is exploratory study. Exploratory study means the researcher, they have to take the topic which is not clearly explained. Okay, if we are going to conduct research, the researcher, they have to take the problem which is clearly explained. We have to take the topic and we have to give the clear solution for that problem. That is called exploratory study. Exploratory study means the researcher, they have to take the topic which is not clearly explained to give the good result for the problem. Next one is descriptive study. Descriptive study means the researcher, they are going to describe only the characteristics of problem. They are not giving solution for the problem. They are going to describe what is it, how it is. Like that only they are giving characteristics. For example, they will describe or identify or assess. Next one is analytical study. Analytical study, the researcher, they will go deeply the study to understand the problem, how it will happen, why it is happened, where it is happened, what solution we have to give. Like that, they will deeply analyze this and they will give the solution for the problem. This is analytical study. There are three types: explorative, descriptive, analytical. Explorative, they are going to give solution for the unexplained problem. Descriptive study, they are going to describe only the characteristics. Analytical study, the researcher, they are going to give the solution for the problem. Next one is process. According to the process, it is having qualitative research and quantitative research. Qualitative research means the researcher, they will conduct the study. In this, they will collect the data, analyze the data, and they will describe the data, what the peoples do and say. What the peoples do and say. That only they will collect analysis. They will not use numerical data. They will not use the numerical data. That is qualitative research. Qualitative research means the researcher, they will collect the data regarding what the peoples doing and saying. They will not use the numerical data. Next one is quantitative data. Quantitative data means the researcher, they will use the numerical data. They will collect the numerical data, how it has happened, how many people are affected by the disease, how many people giving the result. Like that, they will give the numerical data. Next one is outcome. According to the outcome, there are three types: applied research, basic research, action research. Applied research means the researcher, they will give the solution for the practical problem. Okay, they will give the innovative technologies for the practical problem. Next one is basic research. Basic research means through the research, the researcher, they will increase the knowledge of the public or increase the knowledge of the researcher. They will give the basic knowledge about the particular problem. Next one is action research. The researcher, they will give the solution. That solution should be applied in their life, applied in the practice. This is the action research. Okay, according to the outcome, applied research, the researcher, they will give solution for the practical problem. Basic research, the researcher need to improve the knowledge of that particular problem. Action research, the researcher, what they have identified solution for the problem, that they are putting into action in the human life. This is the types of research. Types of research, it is having three classification: purposes, process, outcome. According to the purpose, it is having three types: explorative, descriptive, and analytical. According to the purpose, it is having two types: qualitative and quantitative. According to that outcome, it is having applied, basic, and action research. This is okay. After formulating the statement of problem, after writing the statement of problem, you have to write objectives. What is your aim at the end of your research? What you are going to achieve? What result you are going to get? You have to predict and write. Objectives, you have to predict and write. Next one is review the literature. You have to collect the review of literature for your statement of problem. Whether already this problem already conducted by some others, whether I can get the review for the statement of problem, whether I can get the some ideas regarding the statement of problem. Like that, you have to search the books, journals, internets, or already conducted study books or funding agencies. You have to collect the review material for your statement of problem. Next one is select the sampling technique and research design. Okay, after collecting the review of literature, you have to select the sampling technique and research design. To whom you are going to conduct the research, how you are going to conduct the research, which design you are going to use for the research. Like that, you have to write it in written form. Next one is you have to carry out the research study by data collection. You have to start your research by data collection. It may be the interview schedule, or it may be the observation, or it may be giving the intervention. You have to collect the data. Next, you have to analysis and interpretation. You have to do that statistical analysis. You have to do that biostatistical analysis, whether I got the result, whether I got the conclusion, whether my studies are giving new ideas. Like that, you have to analysis and interpret. After analysis and interpretation, you have to write the research report. You have to write your conclusion of your research study, whether you got good result, whether you have faced any problems in your research. Like that, you have to write the research report. After writing research report, you have to present the research report in your research committee. If you got permission from the research committee, if you got approval from the research committee, you can publish your paper for getting the copyright or patent for your research. Okay, if you are not getting good result, you have to find out the problems, what problem began the research result, why I didn't get the good result. Like that, you have to identify the problem, you have to rectify the problem, and you have to find out the solution for the problem. Again, once again, you have to start the research from the first step. Okay, this is the steps of research process. Steps of research process: first one, define the problem. Second one is formulate the statement of problem. Third one is formulate the objectives and hypothesis. Next one is write the review of literature. Next is selecting the sampling technique and research design. Next is carry out the research by conducting the research. Next one is analysis the interpretation and research report. Next, you have to go for the repetition. This is something about basic research. In this session, we have studied what is research, what is the meaning of research, what is the definition of research, what is the need of research in nursing, what is the characteristics of research, what is the purposes of research. Next, we have seen types of research, steps of research process. Still now, we have seen that what are all the things we have studied in this session means what is research, what is the definition of research, what is the meaning of research, what is the need of research in nursing, what is the purposes of nursing research, what is the types of research, what is the steps of research process. Okay, this is the something about research process. Thank you for your patient listening and watching my video. Thank you everyone.